My name's Maureen Anderson, and I became involved in infectious disease control during my residency, which was in 2008. I did a thesis on methicillin-resistant Staph aureus in horses, or MRSA. And since then, I've gotten more and more involved in infectious disease control. I helped Dr. Scott Weiss start a blog about zoonotic diseases and infectious diseases in animals and people. And then I started working on my PhD, which is all about infectious disease control and hand hygiene in veterinary medicine. There are quite a number of things that any horse owner should discuss with their veterinarian to determine what are the best vaccines for their particular horse. There are factors to do with the farm, what kind of horses are there, whether they come and go, factors to do with your horse in particular and what your horse is used for, where it's going to travel to, factors to do with you yourself as the owner and how comfortable you are with whether your horse may get sick or whether you want to give it a vaccine or have a vaccine given to it. And there are factors to do with the season, where your horse is living, and the area. So it's really important to have a good conversation with your veterinarian to make sure you've covered all those different factors so that you can design the best vaccine program possible for your specific horse where it is living. Booster shots are very important when it comes to vaccines because a single dose of vaccine isn't going to protect your horse for the rest of its life. Some vaccines you only need to give a booster annually. Things like rabies and tetanus are excellent vaccines, and the immunity will last at least a year, if not more. So they only need to be given every 12 months. Other vaccines, such as vaccines for equine influenza or equine herpes virus, need to be given more often, particularly if your horse is going to be exposed to those diseases frequently, because you want to keep their immunity at a really good level to help prevent disease or lessen the impact of disease if the horse is going to be exposed. So in a case of a show horse, for example, that is showing heavily during the summer, they'd want to be vaccinated every 6 months. If a horse misses a booster shot, it doesn't necessarily mean the booster can't be given later on. It just means that between the period when the horse should have gotten its booster and when it actually gets its booster, it may not be as well protected against the disease you are trying to prevent. If your horse is not competing in a particular year, it might not require the same vaccines it would in a competition year, and that's absolutely fine. We don't actually want to give horses unnecessary vaccinations. So if your horse is not going to compete, and it's not going to be exposed to, for example, things like herpes virus or flu or strangles like it would in a competition year potentially, then it does not necessarily need to get those vaccines at the same frequency your horse would during a competition year. Even if your horse is not competing in a particular year, though, there may still be exposure risk from other horses on the farm that are still competing that year. So even though your horse might not get all the same vaccines, a lot of them may still be important because of the risk of exposure from other horses on the premises. So major diseases of concern to horse owners in Canada today that are vaccine preventable or that there are vaccines available for would be things like rabies, particularly in Ontario where we have problems with it, tetanus, West Nile virus. Those are sort of your basic core diseases that kind of everybody needs to worry about. And then there are diseases that are more likely or less likely for your horse to be exposed to depending on what they do. And those are things like equine herpes virus, 1 and 4. One is respiratory and one is primarily reproductive and neurological problems. Equine flu, strangles is very important, of course. And we still see outbreaks of that on a regular basis. And then there are things that are very area specific. So things like, for example, Potomac horse fever. There are certain areas in Ontario where that's really important. Eastern equine encephalitis has been reported in a few different provinces, and it causes some severe neurologic disease, and that's also very important to consider, and there is a vaccine for that. Because disease patterns are constantly changing, it's really important to try to stay up to date on what diseases are specific to your area. The best source of information for that is certainly your veterinarian, but there are other places you can look. For example, the Worms and Germs blog that is run on the University of Guelph website is a great resource for emerging outbreaks, which get reported there when they occur. There's also the Canadian Food Inspection Agency website, or the CFIA, and the CFIA is in charge of reportable animal diseases in Canada. There's often a question of how many vaccines can a horse be given at one time, and there's really no definitive answer for that. But you have to remember that vaccination is an active process. Every time you give a horse a vaccine, the horse's immune system has to respond to it. So the more vaccines you're giving a horse at once, the harder you're going to be on the horse's system, and likely the less of a response you'll get to each individual vaccine. So if you can spread out the vaccines, that would be ideal. 2 or 3 at the same time is very common. If you can spread them out even more than that, fantastic. But you probably don't want to be given, for example, 8 vaccines all at the same time, because you're not going to get a good response, and it's going to be very hard on the horse's immune system. The Equine Guelph Vaccination Equi-Planner is a really great resource for people who want to set up a vaccine program for their horse. It has lots of great information on it, so it gives you all those different things you need to think about when you're trying to plan your program. It doesn't replace talking to your veterinarian, and it's definitely something that you can look at with your veterinarian even to make sure that you're not missing any of those really important factors when it comes to planning. But it's a great start for horse owners. It's got lots of good, concise information, and it's really easy to read, and I definitely recommend you take a look at it.